You ever wake up in the morning and your doctor hands you another prescription, telling you your blood pressure is creeping up again? Maybe you're already taking medication, watching your salt intake like a hawk, and still seeing those numbers climb higher than you'd like. If you're over 50 and living in the United States, you're part of a staggering statistic that should make us all pause and think. Nearly half of all American adults have high blood pressure, and for those over 50, that number jumps even higher. We're talking about 116 million people walking around with a ticking time bomb in their chest. Meanwhile, across the Pacific Ocean in Japan, people in their 70s, 80s, and even 90s maintain blood pressure readings that would make a 30-year-old jealous. They're not taking handfuls of pills every morning, they're not spending thousands on treatments, and they're certainly not accepting high blood pressure as just another inevitable part of aging. The difference isn't genetic. It's not about expensive supplements or complicated medical procedures. The difference is in something so simple, so accessible, that you can start doing it right now in your living room, and you'll begin seeing changes in your numbers within weeks. In the next few minutes, I'm going to walk you through exactly what these movements are, why they work specifically for people over 50, and how you can use them to take back control of your cardiovascular health. But before we dive in, drop a comment below telling me your name and what state you're watching from, because I love knowing who's part of this community. Let me be crystal clear about something right from the start. I'm not telling you to throw away your blood pressure medication or ignore your doctor's advice. What I'm sharing with you today works alongside your treatment plan, and many people find that as they consistently do these exercises, their doctors are able to reduce their medication over time. But that's a conversation you need to have with your healthcare provider, not a decision you make on your own. What I'm telling you is that your body has an incredible ability to regulate blood pressure naturally when you give it the right stimulus. The research on this is overwhelming. Studies from the American Heart Association, the Mayo Clinic, and dozens of universities have shown that certain exercises can lower blood pressure as effectively as some medications, without any of the side effects. Let's talk about why blood pressure rises as we age in the first place. As you get older, your blood vessels naturally lose some of their elasticity. Think of a brand new rubber band compared to one that's been sitting in a drawer for 20 years. That old rubber band doesn't stretch as easily, right? Same thing happens to your arteries. They get stiffer, less flexible, and that means your heart has to work harder to push blood through them. On top of that, most Americans over 50 are sitting way more than they're moving. All that sitting makes your blood vessels even stiffer and causes your blood to pool in your lower body instead of circulating efficiently. Your heart sees this and thinks it needs to pump harder, raising your blood pressure to compensate. Add in stress, which floods your body with cortisol and adrenaline that constrict your blood vessels, and you've got the perfect storm for hypertension. But here's the beautiful thing about your body. It doesn't matter if you're 55, 65, or 75 years old, your blood vessels can still regain flexibility, your heart can still become more efficient, and your nervous system can still learn to relax, instead of staying in constant fight-or-flight mode. The first exercise is called the wall breath stand, and it's going to revolutionize how you think about lowering blood pressure. In Japan, there's a breathing practice called Seishin Kokyu that roughly translates to spirit breathing, and it's been used for generations to calm the nervous system and improve circulation. Here's how you do it. Stand with your back against a wall, feet about 6 inches away from the baseboard, shoulder width apart. Press your entire spine against the wall, from your tailbone all the way up to the back of your head. You might need to tuck your chin slightly to get your head flat against the wall, and that's perfect. Now place your hands on your belly, right below your ribcage. You're going to breathe in slowly through your nose for a count of 4. And as you breathe in, push your belly out against your hands. This is crucial because most people breathe shallow into their chest, which actually triggers a stress response. When you breathe deep into your belly, you activate your parasympathetic nervous system, which is your body's natural relaxation system. Hold that breath for a count of 2, then exhale slowly through your mouth for a count of 6, feeling your belly pull back in. The exhale is longer than the inhale, and that's intentional because it's during the exhale that your blood pressure actually drops. Do this for 2 minutes straight, and you'll feel your shoulders drop, your jaw unclench, and a wave of calm wash over you. The wall behind you is doing important work too. It's realigning your posture, taking pressure off your lower back, and helping blood drain from your legs back toward your heart. Do this exercise 3 times a day, morning, afternoon, and before bed. and within 1 week you'll notice your resting heart rate starting to come down. Within 2 weeks, you'll see changes in your blood pressure readings. The second exercise is the seated ankle pump flow, and this one specifically targets something called venous return, which is how efficiently blood gets back from your feet and legs up to your heart. When you're over 50 and you've been sitting most of your life, the valves in your leg veins get lazy. They're supposed to prevent blood from flowing backward, but they start to lose their strength, which means blood pools in your lower legs and feet. Your heart detects this and raises blood pressure to try to force that blood back up. This exercise fixes that problem in the most elegant way possible. Sit in a firm chair with your feet flat on the floor, back straight, and hands resting on your thighs. Lift your heels off the ground while keeping your toes planted. Hold for 2 seconds, then lower your heels and lift your toes while keeping your heels planted. You're essentially rocking your foot from toe to heel, in a smooth, controlled rhythm. Now here's where it gets interesting. As you lift your heels, breathe in. As you lift your toes, breathe out. This coordination between movement and breath creates a pumping action that literally milks the blood out of your lower legs and sends it back to your heart. Do this for 3 minutes straight, and you'll feel your feet and ankles become warmer as fresh, oxygenated blood floods into them. The beauty of this exercise is you can do it anywhere, sitting at your desk, watching TV, even sitting in your car at a red light. Do this exercise 4 times throughout your day, spacing them out by a few hours. After 2 weeks of consistent practice, your heart won't have to work as hard to overcome gravity and poor venous return, which means your blood pressure naturally comes down. The third exercise is called the forward fold hang, and this one is specifically designed to reverse the effects of gravity on your cardiovascular system while gently stretching the entire backside of your body. Stand with your feet hip-width apart, knees slightly bent, never locked straight. Place your hands on your thighs, take a deep breath in, and as you exhale, slowly hinge forward from your hips, sliding your hands down your thighs toward your knees. Only go as far as feels comfortable. And here's the critical part. Keep your knees soft and bent the entire time. This isn't about stretching your hamstrings to the max. It's about inverting your upper body so that your heart is now level with or slightly below your hips. This position immediately changes the pressure gradient in your cardiovascular system. Your heart suddenly doesn't have to fight gravity to get blood to your brain. And all those blood vessels in your neck and head that are usually working overtime can finally relax. Hang here for 30 seconds. Breathing slowly and deeply. Let your arms dangle like wet noodles, let your head hang heavy, and feel gravity gently pulling on your spine. After 30 seconds, don't pop right back up, or you'll get dizzy. Place your hands back on your thighs and slowly roll up one vertebra at a time, letting your head come up last. Do this exercise twice a day, once in the morning and once in the evening. Now, let me show you how to combine these 3 exercises into a daily routine that takes less than 10 minutes total, but delivers results that will shock your doctor at your next checkup. Your morning routine should take exactly 5 minutes. As soon as you wake up, before you check your phone or turn on the TV, do the wall breath stand for 2 minutes. Then move directly into the forward fold hang. Do it twice, holding each one for 30 seconds with a 15-second rest in between. Finish with 1 minute of the seated ankle pump flow while you're sitting on the edge of your bed. 5 minutes total, and you've just told your cardiovascular system that today is going to be different. Throughout your day, set 3 alarms on your phone. Space them out every 3 to 4 hours. When that alarm goes off, take 2 minutes to do the seated ankle pump flow. Before bed, give yourself another 5-minute window. Do the wall breath stand for 2 minutes to activate your relaxation response before sleep. Then do the seated ankle pump flow for 2 minutes. Finish with 1 forward fold hang, holding it for a full 60 seconds this time. This entire routine adds up to about 15 minutes of total exercise time spread throughout your day. But the impact on your blood pressure is profound and measurable. Within the first week, you'll notice you feel calmer, less anxious, and more grounded. Within 2 weeks, if you're checking your blood pressure at home, you'll start seeing the numbers come down. Within a month, the changes become significant enough that your doctor will notice. I've worked with hundreds of people over 50 who came to me taking 2 or 3 blood pressure medications, and within 3 to 6 months of doing these exercises daily, their doctors were able to reduce their medication. The philosophy behind this approach comes from something the Japanese call kaizen, which means continuous improvement through small, consistent changes. You're not trying to become a marathon runner. You're trying to make small deposits into your health account every single day that compound over time into major improvements. High blood pressure didn't happen overnight. It developed over years, maybe decades, of sitting too much, stressing too much, and not giving your cardiovascular system the movement stimulus it needed to stay flexible and efficient. But you can absolutely reverse it over time with consistent, intelligent movement that works with your body's natural healing abilities. Before you go, I need you to do two things for me. First, drop a comment below with your name, your age, and what state you're from. Tell me what your biggest challenge is with high blood pressure, and what you're most excited to try from this routine. I read every single comment and I respond to as many as I can. Because this isn't just a channel, it's a community of people over 50 who refuse to accept that aging means declining. Second, I want you to commit right now to doing this routine for the next 30 days. Not someday, not when you feel like it, starting today. Mark it on your calendar, set those alarms on your phone, and show up for yourself every single day. If you made it this far in the video, you're serious about your health. This channel exists for people like you, people who are over 50 and want to take control of their health without complicated equipment, expensive programs, or unsustainable routines. Every single week I put out a new video with practical science-backed exercises, designed specifically for your age group and your health challenges. If you subscribe to this channel and hit that notification bell, you'll get a new strategy every week for lowering blood pressure, reducing joint pain, improving balance, boosting energy, and feeling strong in your body again. You've earned the right to feel good in your body, to move without pain, and to live without constant worry about your health. Subscribe because you deserve to have access to information that actually works. Your strongest, healthiest years are still ahead of you, and I'm here to help you get there. Hit that subscribe button, turn on notifications, and I'll see you in the next video. Now get up, go do that first wall breath stand, and start changing your numbers today.